what supporters of this healthcare law are even saying about it. This is Gupta, CNN.
And you can go there and bid, try and get a competitive price because of that bidding.
So now there will be insurance available in all states. It will be mandated. Everyone has to have some sort of insurance. How do we know it's going to be affordable or accessible to everybody? We know that's the idea, but will it be?
Yeah, well, these exchanges, which, by the way, they're not necessarily going to be, we don't know if every state's going to actually sign on to it right now. So far, 10 states have done it. 9 more have said that they intend to do it, but a lot of states may not do it, in which case the federal government comes in and sets up these exchanges. But you're absolutely right. A mandate means that everybody has to get it, and if you can't afford it, then there may be some subsidies to help you afford it. But as a result of doing that, you're distributing the costs across everybody, across healthy people,
spreading the wealth around,
and that's what they believe ultimately is going to help pay for the healthcare system overall. If healthy people buy into the system, it helps offset some of these costs.
So what are the penalties if you don't take
All right,
advantage
watch this.
of the insurance that's being made available? Or
Listen to what he says after this.
And this is interesting, because take a look at the numbers here. This may or may not surprise you depending on your perspective in terms of how high or low they are. The first year, for example, that you refuse, if you decide not to do this, you can take a look at the number there. It's what is it, $95 or 1% of your income, whichever one of those things is greater, and then it slowly starts to amp up. Okay, so $325 or 2% of your income, $695 or 2.5% of your income.
Listen to this.
The point is this: that if you're someone who can't afford to buy it, you should buy it, because ultimately the penalties are probably going to cost you more than the healthcare insurance would. And then that's just what's it.
What did he just say? If you can't afford to buy it, buy it.
And actually buying healthcare insurance. The point is this: that if you're someone who can't afford to buy it, you should buy it, because ultimately the penalties are probably going to cost you more than the healthcare insurance would. And then that's